thank you po. Before we start po, may I ask, is it okay to you to check your background information and your health history before we start po?
Sure. Okay po. Thank you, Ms. Trina. So, for the background information po, what is your full name?
I am Trishia R. Balbidadez.
Okay, your age?
I am 19 years old. Birthday?
November 20, 2002. Your gender?
Female.
Address?
I live at number 9 Santo Niño Street, SFD and Quezon City.
And your contact number po?
0926-084-3847.
Okay, thank you, Ms. Trina. So, let's proceed po to your health history background. So, how do you feel right now, Ms. Trina?
I'm good. I feel good.
Okay po, thank you. Are you allergic to anything like medications, foods, or others po? Okay. Are you taking any medication? Okay po, thank you. Do you or did anyone in your family have any long-term health problems like heart disease, diabetes, kidney disease, bleeding disorder, or lung disease? Oh, okay. Do you or did anyone in your family have any health issues like high blood pressure, high cholesterol, or asthma po? Okay po, thank you. This is the last question po, Ms. Trina. When did you last eat or drink anything po?
Last 2 hours ago, I ate my lunch and I only drink water.
2 hours ago. Okay, I see, Ms. Trina. Thank you po. Thank you for answering my questions po. So, let's proceed to taking vital signs po. So, first po, I will
Check your blood pressure.
Next po is the body temperature. Okay lang po ba itaas niyo po? Then next po, I will check your pulse rate po. Then last po is your respiratory rate po. So, keep calm lang po. Lang. Your vital signs po is normal naman po. So, let's proceed na po sa assessment po. First po, assessing the ears and hearing. First, the preparation. Number 1, assemble equipments and supplies. Otoscope po with several sizes or speculum. So let's proceed to the procedure. Number 1, explain to the clients what are we going to do, why it is necessary, and how can she cooperate. So Ms. Tina, I will assess your ears and hearing. For this po, we can determine if there's a difficulties or abnormalities po in your ear. So, are you willing to cooperate po?
Yes, sure.
Okay, thank you, Ms. Trina. So, number 2 is wash hands and observe other appropriate infection control procedures. So, I will wash my hands first before we proceed to the next procedure. Next one is alcohol rubbing. Alcohol rub. So I'm done performing hand hygiene po. So let's proceed to number 3, which is provides for client privacy. I will ask the client if she wants to close the curtain. Possibly po, if we are in clinical area, we should ask the patient first if she or he wants to close the curtain to provide privacy. Next is, I will tell to the clients that those be kept. So, Miss Trina, all the confidential information that we will be gathered is safe and secured po. Will be kept and safe po. Thank you. So, number 4 po is determine the client's history of the following. So, I will ask the clients first. So, Miss Trina, I will ask some questions po. First po is family history of hearing problems or loss po. Any presence of ear problems po? Medication history po, are you complaining of ringing in ears? Any hearing difficulty po? Hindi naman po. Do you use corrective hearing devices po? Po. Okay. Thank you po, Miss Trina. Then, number 5 po, position the client comfortably seated po if possible. So, let's proceed to the assessment po. So, first, we will assess the auricles. Number 6, inspect the auricles for color, symmetry of size, and position. Then, number 7 is palpate the auricles for texture, elasticity, and areas of tenderness. So, Miss Trina, is it okay to you to touch your ear po? Sure. Okay. So, the step po is gently touch the auricle po, then upward, downward, backward. Then, fold the pinna forward po. Then, push it on the trabus. Masakit po ba, Miss Trina? Then, put a pressure po on mastoid process. Masakit po ba? Then, apply it din po sa kabilang tenga. So, gently touch the auricles upward, downward, and backward. Then, fold the pinna forward, then push it on the trabus po. Give a pressure po on the mastoid process. Masakit po ba? Okay, thank you, Ms. Rina. So, next is assessing the external ear canal and tympanic membrane. So, number 8, using an otoscope po, inspect the external ear canal for cerumen, skin lesion, pus, and glands. We will use the otoscope. And Ms. Trina, is it okay to attach this otoscope into your ear po? Sure. Okay, number 9 po is inspect the tympanic membrane for color and gloss. Then next is gross hearing acuity test. Number 10, assess the client's response to the normal voice tones. If the client has a difficulty in hearing the normal voice, then proceed po to the following test, which is the performing watch tick test. But for me po, I will do the whisper test. So, Miss Trina, I will do the whisper test po. So, can you occlude the right ear po? Then, I will tell some phrase or words po that you should repeat po. Okay, thank you, Miss Trina. So, okay, harap po kayo. Thank you. Okay, can you occlude the ear na po? The side of your ear. Which side? The left ear po. So, okay. Apple. Okay, great. Then the next ear po, the right ear. Can you occlude? Okay. I am strong. Okay, that's good. Thank you, Miss Trina. Then after that po, I will do the tuning part test. First is the performing the Weber test po. I will use the tuning part test po. I will put this into your midline. Then tell me if you hear both sides of your ear po. Okay. Both ears. Thank you, Miss Trina. Then after that, I will conduct the Renee test po. Miss Trina, can you shake your hands if you hear the sounds po? Okay? Okay, Trina. Then last is number 11, document findings in the client's record. Then let's proceed to the assessing the mouth and oropharynx. So first is preparation. Number 1 is assemble equipments and supplies such as the examination glove, tongue depressor, 2x2 gauze pads, and then the flashlight or pen light. So let's proceed to the procedure. Number 1, explain to the clients what are we going to do, why it is necessary, and how can she cooperate. So Ms. Trina, I will assessing your mouth and oropharynx. For this po, we will determine if there's a problem po in your mouth. Is it okay to you?
Yes.
Are you willing to cooperate po? Okay, thank you Ms. Trina. The number 2 is wash hands and observe other appropriate infection control procedures. So I will do the alcohol remedy. Yes, I am done performing the hand hygiene po. Then number 3 is provide for client's privacy. So, all the information that I will be gathering here will be kept and secured. Okay, Ms. Trina, thank you. Then next is determine the client's history of the following. So Ms. Trina, I will ask some questions again. Okay. So what are the routine pattern of dental care po?
I brush my teeth 2 to 3 times a day po. After I eat po.
Okay. Last visit to dentist po.
Last year.
Okay, I see.
Length of time ulcers or other lesions po had been present here.
Okay po, thank you. Any denture discomfort? Any medication that you are receiving po, Ms. Trina? Do you have a partial denture po, like disease po?
Wala po.
Okay, thank you, Ms. Trina. So, number 5 is position the clients comfortably, seated if possible. Then next is the assessment. So, for lips and back of mucosa po, number 6, inspect the outer lips for symmetry of contour, color, and texture. So, Ms. Trina, can you brush your lips po? Okay, thank you, Ms. Trina. Then next is number 7, inspect and palpate the inner lips and back mucosa for color, moisture, and texture, and the presence of lesions.
Where my gloves are po.
Ms. Trina, can you relax and open your mouth po? Okay, thank you, Ms. Trina. Then next po is assessing the teeth and gums po. So number 8, inspect the teeth and gums while examining the inner lips and buccal mucosa. Again, I will ask the patient to open her mouth again po. So Ms. Trina, can you open your mouth? Okay, thank you, Ms. Trina. So next, number 9 is inspect the dentures. But according to Ms. Trina, she doesn't have a partial denture. So let's proceed to the next po. Next is assessing the tongue or floor of the mouth. So number 10 is inspect the surface of the tongue for position, color, and texture. So Ms. Trina, can you protrude your tongue po? Okay, thank you, Ms. Trina. Then next is number 11, inspect the tongue movement. So Ms. Trina, can you roll upward your tongue po? Then side to side. Okay, thank you, Ms. Trina. So number 12, inspect the base of the tongue, the mouth floor, and the frenulum. Ms. Trina, can you tip your tongue po against the roof of your mouth? Okay, thank you, Ms. Trina. Next is number 13, palpate the tongue, floor of the mouth for any nodules, lumps, and or excoriated areas. So I will use the gloves po. So Ms. Trina, can you open your mouth po? So next is assessing the salivary glands. So 14, inspect the salivary duct openings for any swelling or redness. So Ms. Trina, can you open your mouth po? Okay, thank you, Ms. Trina. Next is assessing the the palates and uvula. So number 15, inspect the hard and soft palates for color, shape, texture, and bony prominences. So Miss Trina, can you open your mouth po? And then tilt your head backward. Then number 16 is inspect the uvula for position and mobility while examining the palate. So Miss Trina, can you say apo? Okay, thank you Miss Trina. Then the last is assessing the oropharynx and tonsils. So number 17, inspect the oropharynx for color and texture. So Miss Trina, can you open your mouth po? Okay, thank you Miss Trina. Then number 18, inspect the tonsils for color, discharge, and size. So Miss Trina, can you open your mouth again po? Okay, thank you Miss Trina. Then number 19, elicit the gag reflex by pressing the posterior tongue with a tongue depressor. Okay, thank you Miss Trina. The last procedure is document findings in the client's record. Then next is assessing the neck. So let's proceed to the procedure. Number 1, explain to the clients what are we going to do, why it is necessary, and how can she cooperate. So Miss Trina, I will assess your neck po to determine if there's a problem or any lumps that occurred in your neck po. Are you willing to cooperate po?
Yes.
Okay, thank you Miss Trina. Then number 2, wash hands and observe other appropriate infection control procedures. So I will do the alcohol rub po. Then the third is provide our clients privacy. So I will close the curtain po if we are in clinical area. Then next is number 4, determine the client's history of the following. So Miss Trina, I will ask again, any problems po with neck lumps po? Okay, thank you Miss Trina. Neck pain po or stiffness? When and how any lumps occur po? Okay, wala po. Thank you. Any previous diagnosis of thyroid problems? None? Okay, thank you Miss Trina. Any treatments such as surgery or radiation po? Wala po. Okay, thank you Miss Trina. Then next is the assessment po. For assessing the neck muscles po, number 5, inspect the neck muscle for abnormal swelling or masses po. So Miss Trina, can you erect po your head? Okay. Do you feel any pain po? Okay. Then number 6, observe head movement. So Miss Trina, can you move your chin po to the chest? Move your head po to the back so that the chin po is upward. Then move your head po to the ear towards to the shoulder on each side. Then turn your head po right to the left. Okay, thank you Miss Trina. For number 7, assess the muscle strength. So Miss Trina, I will turn your head po at one side against the resistance of my hand. So, I will shrug your shoulders against the resistance of my hand. So next is the assessing the lymph nodes. So number 8, palpate the entire neck for enlarged lymph nodes. Next is assessing the trachea. Number 9, inspect the trachea for lateral deviation. Do you feel any pain? Sakit po ba? Okay, thank you Miss Trina. So last is assessing the thyroid gland. So number 10, inspect the thyroid gland. So I will observe the lower part of her neck. And Miss Trina, can you hyperextend your head po? And then swallow. Okay, thank you Miss Trina. Then number 11, palpate the thyroid gland for smoothness. So Miss Trina, can you lower your chin slightly? Okay, thank you Miss Trina. Then number 12, if enlargement of gland is suspected, auscultate po, then use bell-shaped diaphragm of the stethoscope. But in the case of Miss Trina po, there is no suspected of enlargement of thyroid gland. So, thank you, Miss Trina. Then the last procedure po is document findings in the client record. And these are my return demonstration of assessing the ear, mouth, and neck. And that's all po. Thank you. Good day everyone. My name is Trishia R from BSN1, BN11. For this video, I will do the procedure of preparing medication from vials. For the preparation, number 1, assemble equipment and supplies such as MAR or computer printouts, vial of sterile medication, antiseptic swabs, needle and syringe, filter needle. Also check the agency policy of it. And the last is sterile water or normal saline if the drug is in powder form. The equipment and supplies that I have here: a vial of sterile water or distilled water, a regular needle and syringe. Since I don't have antiseptic swabs, I have alternative for that, which is the cotton balls with alcohol. Then number 2, implement same preparation described in procedure 33-2. So let's proceed to the procedure. Number 1, wash hands and observe other appropriate
Infection control.
procedures. So I will wash my hands first. Number 2, prepare the medication vial for drug withdrawal. Mix the solution, if necessary, by rotating the vial between the palms of the hands and not by shaking. Then, remove the protective cup or clean the rubber cup of a previously opened vial with an antiseptic wipe by rubbing in a circular motion. Number 3, withdraw the medication. Attach a filter needle as agency practice dictates to draw up a premixed liquid medication from a multi-dose vials. But I don't have filter needle, so let's proceed to the next. Ensure that the needle is firmly attached to the syringe. So check. Then remove the cap from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn. Then carefully insert the needle into the upright vial through the center of the rubber cap and then maintaining sterility of the needle. Then inject the air into the vial and keeping the level of the needle above the surface of the medication. Then withdraw the prescribed amount of medication using either of the following method. Hold the vial down and move the needle tip so that it is below to the fluid level and withdraw the medication. Also avoid drawing up the last drops of the vial. Or invert the vial, ensure the needle tip is below the fluid level and gradually withdraw the medication. Hold the syringe and vial at the eye level to determine that the correct dosage of drug is drawn into the syringe. Then, eject air remaining at the top of the syringe into the vial. When the correct volume of medication is obtained, withdraw the needle from the vial and replace the cap over the needle using the scoop method and thus maintaining its sterility. Then, if necessary, tap the syringe barrel to dislodge any air bubbles present in the syringe. Then, replace the filter needle if used with a regular needle po. Cover the correct gauge po and length before ejecting the client. So, there's no air na po. So, that's all po. For this part, I will do the the procedure of providing a back massage. So first, the preparation. Number 1, assess. Behaviors indicating potential need for a back massage such as complaint of stiffness, muscle tension in the back or shoulders, or difficulty sleeping related to tenseness or anxiety. Next is whether the client are willing to have a back massage because some of individuals may not enjoy a massage. So I will ask the patient first if they are willing to have a back massage. So Mr. Aquesa, are you willing to have a back massage?
Yes.
Okay, thank you Mr. Aquesa. Next is contraindication for a back massage. For example, coagulation issues, clots, impaired skin integrity, back surgery, and vertebral issues or risk for fracture. Then next, number 2, assemble equipments and supplies such as lotion, massage oil, and then the towel for excess lotion. Then number 3, planning. Ensure you have an adequate time available for the back massage. Although the actual skill may require only about 5 minutes, the entire process should be conducted in a calm and unhurried manner. Then number 4, preparation. So determine the client's history of the following. So Mr. Aquesa, do you have previous assessment of the skin?
No.
Okay, Mr. Aquesa, thank you. Do you use any special lotion?
No.
Positions contraindicated for the client. So Mr. Aquesa, do you have a burn or bruise in your back?
No po.
Do you have any kind of skin condition?
No po.
Okay, thank you Mr. Aquesa. Then last is arrange a quiet environment with no interruption to promote maximum effect of the back massage. So let's proceed to the procedure. Number 1, prior to performing the procedure, introduce self and verify client's identity using agency protocol. Then explain to the client what are we going to do, why it is necessary, and how he or she can participate. And also encourage the client to give a feedback as to the amount of pressure that we will be used during back rub. So good day Mr. Aquesa, I am your student nurse Trishia, and may I ask how can I address or call you?
Just call me Fabio.
Oh, thank you Mr. Fabio. For this procedure, I will give or provide you a back massage, and in this back massage po, you will feel relaxed and comfort. So are you willing to cooperate and participate?
Yes po.
Thank you Mr. Fabio. I also encourage you to give a feedback to the amount of pressure that I will be used during our back rub.
Okay po.
Thank you, Mr. Fabio. Number 2, perform hand hygiene and observe appropriate infection control procedure. So I will wash my hand first. So I am done performing hand hygiene. So number 3, provide for client privacy. So if we are in clinical settings or area, we will ask the patient if he or she want to close the curtain. But here, we don't have curtain. So let's proceed na po to the next procedure. Number 4, prepare the patient. Assist the client to move to the near side of the bed within your reach and adjust the bed to a comfortable working height. And for this rationale, this is to prevent back strain. So the available bed here is the folding bed. So I will be the one who will adjust, not the patient. Dahil mababa po yung folding bed, ako na po yung mag-a-adjust. Next is establish which position the client prepares. The prone position is recommended for a back rub. Then side lying position is used when the client cannot assume prone position. Mr. Fabio, which one do you prepare? The prone position, which is nakadapa ka po, or to the inferior of sacral area. Then, ipataas po na. And cover the remainder of the body. So, I will cover. The rationale for this po is to prevent chilling and minimize exposure. So number 5, massage the back. So pour a small amount of lotion or the massage oil to the palm. Keep your hands and hold it for a minute. The lotion bottle can be placed in a bath basin filled with the warm water, but here we will use the massage oil. And the rationale of rub preparation tend to feel the uncomfortably cold to people, and warming the solution facilitate client comfort. So using the palm, begin the sacral area using smooth and circular stroke. Move your hands up the center of the back and then over scapulae. Then massage in circular motion over the scapulae. Move your hands down the side of the back. Then massage the areas over the right and left iliac. Press. Then massage the back in orderly pattern using a variety of strokes and appropriate pressure. The first stroke is effleurage. Hindi naman po ba masakit, Mr. Fabio?
Hindi po.
Then the second stroke is the petrissage. The next stroke is the tapotement. Okay lang po ba, Mr. Fabio?
Okay lang po.
Then the last stroke is the vibration. In the procedure number 6, one suggested pattern po for a back massage is apply firm continuous pressure without breaking contact with the client's skin, and repeat above for 3 to 5 minutes, obtaining more lotion as necessary. So yung kanina po na ginawa ko is nung nakulangan na po sa oil is dinagdagan ko po ng oil. Okay ka lang po ba, Mr. Fabio?
Okay lang po.
Okay, thank you. While massaging the back po, assess for skin redness and areas of decreased circulation. Check po kung namumula sa kanyang skin or some irritation po. Then the last procedure in number 6 is pat dry any excess lotion with a towel. That's it po. So the number 7 is evaluation. Mr. Fabio, narelax ka po ba? Yes po. Thank you, Mr. Fabio. Wala ka bang naramdaman na kahit anong sakit or wala po? Okay, thank you, Mr. Fabio. Then the last procedure is documentation. Document that a back massage was performed and client's response, and also record the unusual findings. Then after that, clean the articles or the equipments, then wash our hands. Assess the appearance and size of the wound or at-risk area. Then assess for the amount and character of the exudate. Then assess for complaints of discomfort. Then assess for a sign of infection. Then the second is assemble equipments and supplies such as the clean gloves, sterile gloves. It is optional po. Then the hair scissors or clippers, then the alcohol or acetone, then the moisture proof bag, then the sterile gauze, and the wound cleaning agents specified by the physician or agency, then the wound barrier dressing, and then scissors, and the last is the paper tape. So the equipments and supplies that I have here, the available lang po is the clean gloves, the you will need to cooperate and participate?
Yes.
Okay, thank you, Ms. Karina. Then the second procedure is wash hand and observe appropriate infection control procedure. So I will wash my hands first before proceeding to the next procedure. So I'm done performing the hand hygiene. So let's proceed to number 2, which is provide for a client privacy. If we are in clinical area, I will ask the patient, the client, if he or she wants to close the curtain. Here po, we don't have curtain here because we are not in clinical area. So let's proceed na po to the next, which is expose only the wound area.
So number 4, apply clean gloves and remove the existing dressing and discarding it into the moisture-proof bag. So number 5, thoroughly clean the skin area around the wound and then wash hands and put on clean gloves po. So let's proceed na po to the next which is clean the skin well with the normal saline or a mild cleansing agent. And always rinse the adjacent skin before applying a dressing. So I don't have normal saline po, but I have an alternative po, which is the betadine. I will discuss the procedure first po. Clip the hair about 5 cm or 2 inches po around the wound area if indicated. Then remove gloves and dispose of them in the moisture-proof bag. Then number 6 is clean the wound if indicated po. Put on clean or sterile gloves in accordance po with agency practice. Clean the wound with the prescribed solution. Dry the surrounding skin with dry gauze. Number 7, assess the wound. Then number 8 po, apply the wound barrier. Review the instruction on the barrier package and remove part of the paper backing on the dressing. Then apply the dressing at one edge of the wound site, allowing at least 2.5 cm in 1 inch of coverage of the skin surrounding the wound. So gently lay or press the barrier over the wound. Keep it free of wrinkles but avoid stretching it too tightly. Remove and dispose of gloves po appropriately. But here po, the procedure na po na nagawa ko is I cover the wound po using the sterile gauze. So number 9, reinforce the dressing only if absolutely needed. And apply paper or other porous tape to window frame the edges of the dressing. So number 10, assess the wound at least daily to determine the extent of serious fluid accumulation under the dressing, wound healing, and the need to repair the dressing. If the dressing is leaking, remove it and apply it another dressing. The last is number 11, document. Document the dressing change, wound status, and also the last is the client's response. Then after that po, wash our hands and then clean the equipments po na nagamit natin during the procedure. Those are the 3 procedures that I have learned during our class, and that's all po. Thank you.